Thank you for joining us today. Today's webinar will be reviewing the guidelines for the management of pediatric sports-associated concussion within Marin County. My name is Srinivas Ganesh, and I'm a board-certified sports medicine physician at Kaiser Permanente in San Rafael. I'm joined by Kit Holston, supervisor for athletic training at Marin Health. Over the past few years, several laws have been passed at the state legislature level regarding youth sports and concussion-related care. AB 25 and 2127 require concussion information to be sent to students and their parents and guardians. They also restructured football practice times to limit the amount of hitting. These laws prohibited high school and middle school football teams of school districts, charter schools, or private schools that elect to offer an athletic program from conducting more than 2 full contact practices per week during the preseason and regular season. They also prohibited the full contact portion of a practice from exceeding 90 minutes in any single day and completely prohibited full contact practice during the off-season. These laws provided that an athlete suspected of sustaining a concussion or head injury is prohibited from returning to the athletic activity until the athlete is evaluated by a licensed healthcare provider, as defined to mean a licensed healthcare provider trained in the management of concussions and acting within the scope of his or her practice. The athlete would also have to receive written clearance from a licensed healthcare provider prior to return to sport. These laws further provided that if a licensed healthcare provider determined that the athlete sustained a concussion or a head injury, the athlete is required to complete a graduated return to play protocol of no less than 7 days in duration under the supervision of a licensed healthcare provider. Furthermore, AB 2007 mandated that youth sports organizations follow AB 2127 for concussions or other head injuries. This law extended these provisions from scholastic sports and applied them to athletes participating in youth sports organizations, amateur sports competitions, training, camps, or clubs in which persons 17 years of age or younger participate in any of 27 designated sports. In response to the passing of these laws, a coalition was formed that worked to coordinate countywide protocols for education, reporting, and treating concussions among Marin student athletes. This coalition consisted of Kaiser Permanente, Marin Athletic Foundation, MCOE, Marin County School Nurses, Marin County Health and Human Services, Marin General Hospital, Novato Community Hospital, Schurig Center for Brain Injury Recovery, and athletic trainers. Resources related to this webinar and the management of pediatric sports-related concussions can be found at www.concussionsmartmarin.org. This website has information for healthcare providers, students, parents, coaches, and athletic trainers and schools. The forms that we will review during the webinar can also be found through this website. The protocol for on-field management of pediatric sports-related head injuries is as follows. It is divided into 4 stages. First, when a sports-related head injury is suspected, the athlete is removed from the game and a sideline assessment is made. This is typically performed by an athletic trainer, coach, or team physician. The sports concussion assessment tool is often used to make the initial determination whether the athlete has sustained a concussion. Next, depending on the severity of the symptoms, the athlete may be sent to the emergency room or advised to follow up with their pediatrician or family medicine physician the next day. The player may not go back into the game. An initial medical clinical assessment is made at the emergency room or doctor's office visit. This is when a diagnosis will be made whether the athlete has sustained a concussion. It is important to note that the athlete may have had symptoms consistent with a concussion at the time of injury and resolved by the time they've had their initial clinical assessment. It still means that they had sustained a concussion. Also, it's not uncommon for symptoms to initially subside and then recur or worsen several days later. That's why the athlete who has sustained a head injury or concussion may not return to sport no less than 7 days in duration from the date of injury and under the supervision of a licensed healthcare provider. Sometimes the athlete does not recover as anticipated or hoped for. If the athlete experiences persistent symptoms, or if they've had multiple prior concussions or underlying health conditions such as headaches, learning difficulties, or psychosocial issues, it may be useful to consult a specialist relevant to the area of concern. For example, if the athlete is unable to progress back to his or her sport or has had multiple concussions in the past, a sports medicine consultation would be appropriate. If the patient has persistent headaches or has had an underlying history of headaches or migraines, the involvement of a pediatric neurologist may be useful. If the athlete has underlying psychosocial issues, including anxiety and depression, a specialist in behavioral medicine is an option to consider as well. Occasionally, further testing and treatment, such as vestibular training and neuropsychological testing, may be employed to address balance issues as well as return to learning difficulties, respectively. At this point, I'm going to hand it over to Kit, who will go over a case study to review the county's protocols and the forms that you can use to communicate with parents, the schools, and other relevant healthcare providers, such as the athletic trainers and nurses at the schools. Kit?
Thank you, Dr. Ganesh. Today, I will be going over a case study of an athletic injury that happens here in Marin County and the forms and protocol that Marin County has put together to use. Our case study is a 16-year-old female soccer player who, during a soccer game, suffers a head to head hit. She immediately starts to have concussion symptoms and is pulled out of the game by the school's athletic trainer. The athletic trainer then performs a sideline concussion assessment test, or a SCAT 5, and determines that there is a possible concussion and the student athlete would need to see their physician. Immediately, the athletic trainer pulls the athlete from the rest of the game. The athletic trainer then calls and informs the student's parents and gives them the county protocol forms. Then, the athletic trainer then informs the school. The first form that you may see is a head injury report form. Now, this form is only for a school. The idea is that the school, the athletic trainer, or coach can fill out this form, give more information to this parent or guardian who's picking up the student athlete from the event, and it also provides signs and symptoms of a more traumatic brain injury and when to take the student athlete to the ER. As physicians, this form is just something that you may see, but the next form is the head injury referral form, and this is the form that you will need to fill out. As you see on this slide, the head injury referral form is set up in 3 parts. The top part, as you see here, has the date, the name of the staff member making the referral, the student's name and date of birth, and the school that the student is at. The middle of the form is a part of the form that the athletic trainer, coach, or school designee they can fill out to show signs or symptoms that the athlete had at the time of the injury, or they can show that they are including a SCAT 5 along with this form. Then they can give you details of the injury that occurred, so you have more information from an adult who was present at the event. Then you'll see here at the very bottom of that middle section, we can attach the return to learn and the return to play forms for you, and also a head injury report if there's more information that may be needed. The bottom of the form is for the physician to fill in. It has 2 checkboxes, either saying, yes, a concussion has occurred, or no concussion, and the athlete may resume all activities without restrictions. If you are diagnosing a concussion, you can then checkbox a recommended standard for initial treatment. You can also include the return to learn instructions, return to play, and return to play clearance. Then you can put the date that the student athlete may be returning to see you in person or via the telephone. Then we ask the physician to print their name, sign, and date. The next is the return to learn aspect. Because we're looking at student athletes who are students, we must have some kind of form for a physician to fill out for any additional communication or recommendations for the student at the school. As you see here, this is what the form may look like. It says school accommodations following concussion. The top part of the page is going to have, the student's name and the date. Then you are entering your name and the day that you may be reevaluating them. This is for the school in case they have any questions about what they can do in class with modifications. And as you see at the very top, we start with attendance and breaks. We tried to make it as simple as we could by just having check boxes for all of the different sections that may be needed for modifications. And then on the right-hand side, you can see a section to fill in notes. Then we also have just a basic information page for concussion return to learn protocol. In this, you may see different things like brain rest, restful home activity, partial day, and full day. This is more just of an informational page for parents, but you may be able to use it to help with teaching and modifications. Next, we go into the return to play protocol. Now, as a reminder, the California State Law AB 2127 states that return to play or competition cannot be sooner than 7 days after evaluation by a physician or a licensed medical professional who has training in concussion protocols. This graduated return to play protocol must be completed before the student athlete can return to full competition. A certified athletic trainer, physician, and/or an identified concussion monitor may monitor the student's progression through the return to play, but that we must go through it. As you see here, this is the CIF concussion return to play protocol that Marin County has adopted. And in this, there is a 7-day progression through the steps. Stage 1 is 2 days of symptom-free of any symptoms. Stage 2 is then a 4-day step, with each day as a progression through physical activity. Then there's stage 3, which is returning back to practice. Now we have 2 separate days with this. One is a limited contact practice. So mostly they're just getting back to the sport with a full practice, but there's no actual contact. For football, this would be actual thud or live contact, or in a sport like basketball, there's no scrimmaging. Then the second day of stage 3 is a full contact practice, or no restricted or unrestricted no modifications practice, which means they're fully back in practice, live, thud, scrimmage, but that they're doing as much that they can with no return of symptoms. Then, if they go through all of that 6-day protocol, then they can return to play. So what we did is we created a concussion return to play clearance form. In it, you see at the very top, it has AB 2127 on there at the top, so you can help make sure that you are educating the parents if they have questions. Then it has 2 separate clearance lines for signature. One, the top one, is showing that the student athlete may start return to play, but only stage 1 and stage 2. Stage 1 being the symptom-free days, and stage 2 is that gradual return of physical activity. Then the second line is clearance for stage 3 and stage 4 of the return to play protocol, meaning they're returning back to practice each day, slowly increasing the intensity on the student's athlete. So with this form, the physician can either sign both or just one, depending on the physician's opinion and thought process of the return to play. Thank you, everyone.
Thank you for again joining us today. For further information regarding the management of sports concussions in the pediatric population of Marin County, please visit concussionsmartmarin.org.